Hello everyone, this is Dr. Gobind Garg. So in this video, we will discuss the questions that were asked in INICET May 2025. So starting with the first question. In this question, there is 62-year-old male and he has chronic heart disease and renal failure and he was given phenoldopam. Phenoldopam. Question asked is how phenoldopam improve renal function. So we all know the name of phenoldopam says phenoldopam. We will speak 3-4 times phenoldopam, phenoldopam, phenoldopam. It look like we are saying only dopa, only dopa, only dopa. So phenoldopam is a drug which stimulate only D1 receptors. So it is a D1 receptor agonist. And we know D1 receptors are present in the blood vessels. They cause vasodilation and they are maximum in the blood vessels of kidney. So the primary mechanism will be to cause renal vasodilation by stimulating D1. So it will increase renal blood flow and protect the kidney. Okay. So phenoldopam, it is a D1 agonist and it is used mainly in hypertensive emergencies. Okay. Moving to next question. So this is a question in which person has some sexually transmitted disease. So as it is given by painful urination, urethral discharge, flank pain, and it is caused by gram-negative diplococci. So that means gonococci. Gram-negative diplococci, we have only two, meningococcus, gonococcus. So UTI or sexually transmitted disease caused by gonococci. So it is a gonococcal infection. But important thing is it is resistant to penicillins. Drug of choice for gonococci normally are penicillins, but it is resistant to penicillins. So what we will use? We all know drug of choice for gonococci is now ceftriaxone because most of them are resistant to penicillins. Remember here, if penicillin resistance is there, that does not mean that cephalosporin resistance will be there because there are penicillinases producing bacteria. Gonococci produce penicillinase, not a extended spectrum beta lactamase. So penicillinase only. So they will break penicillin, but they cannot break cephalosporins. So that's why cephalosporins, particularly ceftriaxone, is a drug of choice. Okay. Amoxicillin is a penicillin, so it will not be effective. Vancomycin is only for gram-positive bacteria. It will not be effective. And tetracyclines are static drugs and used for other infections, not commonly for gonococci. So the answer is ceftriaxone. Okay. Moving to next question. So this is a question in which they have asked the treatment of scabies in infants. Scabies in infants. So remember, in infants we use only topical drugs. Here also the option given are topical drugs. The plans to give topical drugs. So topical drugs, two main drugs we are using in infants. One is obviously permethrin, which is a drug of choice. 5% permethrin is a drug of choice. And second, we use crotameton. Crotameton is also useful in infants. One more which is not used commonly nowadays is sulfur. So sulfur, permethrin, crotameton, they are used in infants. So the answer will be 1 and 3. 1 and 3. Remember, benzyl benzoate is irritative, so it is usually avoided in infants. And ivermectin is given orally. It is not topical drug and usually we do not give in infants. Okay, so the answer is 1 and 3. Okay. Next question. So this is related to drug schedules. So before going to the question, let's quickly revise different schedules. So we have several schedules. The important ones I have enumerated. So schedule C, it is for cold storage. So the drugs which require cold storage like vaccines or any drug which required to be stored in the refrigerator, that is schedule C. Then G, it is for medical supervision. The mnemonic you can remember is guidance. Under expert guidance, that means under the guidance of a medical supervision, these drugs should be given. So these drugs may include any drug like which requires supervision, maybe hormones, maybe vaccines, they also will be included. Remember, one drug may be in more than one schedule also. Then schedule H is the commonly asked. These are the prescription only drugs, cannot be given without prescription. And schedule H drugs, you can remember, they require handwritten prescription. So handwritten, H for handwritten prescription, that is our mnemonic. So any drug which require prescription is schedule H drug. Remember, schedule G, mostly they are also in schedule H because we require prescription and also guidance. Okay. Then schedule J, you can remember Jadoo. So this is not for the drugs, this is for the diseases. So here the disease where we cannot know that there is any cure. We do not know there is any cure, like HIV, AIDS, there is no cure. Cancer, there is no cure. So no company can advertise a drug that this cures this disease. Clear? So HIV, cancer, diabetes, so these diseases they come under schedule J. So J मतलब जादू से ठीक कर देंगे, जादू से ठीक नहीं कर सकते. Then M for manufacturing. So we have good manufacturing practice. So this schedule gives the guidelines of the manufacturing unit of the drugs. So how to properly manufacture a drug, which condition to be met. Then P for period. So this schedule describes the shelf life of the drugs. So how long a drug can be stored in different drugs. Then schedule T is for traditional medicine. Traditional. So Ayurveda, Unani medicine, the regulations according for that is given in schedule T. Then X means extreme caution. Extreme caution means, so these are addictive drugs basically. So they require double prescription. The pharmacist has to save the photocopy of the prescription. So extreme caution is required. So mainly for addictive drugs like morphine, ketamine, they fall under schedule X. Then schedule Y is yes to clinical trials. So basically this gives the guidelines for the new drug for clinical trials. For clinical trials, how to go about is described under schedule Y. And Z for U. U means animals. So veterinary drugs, they are given under schedule Z. Okay, so I hope you can remember them easily. So quickly revising: C for cold storage, G for guidance, supervision is required, H for handwritten prescription is required, J for जादू से ठीक नहीं कर सकते, that means diabetes वगैरह या कैंसर वगैरह वाली diseases, M for manufacturing, good manufacturing practice, P for period, that means shelf life of a drug, T means traditional medicines, X means extreme caution, that means addictive drugs, Y means yes to clinical trials, and Z means U, that means veterinary drugs. Okay, so now we will go to the question. It will become much easier. So now see which schedule tells about which drug. So hepatitis V vaccine, we have veterinary drugs, we have morphine, we have insulin. Out of these two, you can easily remember from the name itself, veterinary drugs are, yes, veterinary drugs are schedule Z. Morphine, schedule X. These two you can easily remember. From that you can solve the question. So 2 is 4, 2 is 4. That means B is 4. B is 4 is only in one case. And C, morphine, C is X, C is 1. So that is also true. So that means A is 3. So hepatitis V vaccine should be given under guidance. And insulin is schedule H drugs. H you can remember, hormones etc. they come under schedule H drugs. Okay. So this is the answer. Okay. Moving to next question, which is false regarding thalidomide. We know thalidomide was used for vomiting earlier, pregnancy-induced vomiting, but later on it was found to be causing phocomelia. So it is highly teratogenic drug. It can cause phocomelia. It affects a protein called as cereblon that normally help in affecting the development of limbs. So when this is affected, limbs are not formed, so phocomelia occurs. So because of phocomelia, its use was decreased. Then later it came for another indications, mainly immunosuppressant indications. Two main indications where it is used. One is erythema nodosum leprosum, that means type 2 lepra reaction, and in multiple myeloma. So here its primary mechanism is immunosuppression affecting various cytokines. Okay, and its major side effect is, apart from teratogenicity, it can cause peripheral neuropathy. Okay, so these are the important points you need to remember. Now question asked, what is false? So it is teratogenic, right? It is used in type 2 lepra reaction, right? It is used in multiple myeloma, right? It is anti-metabolite is wrong. It is not anti-metabolite. It affects the cytokines. Okay. So the false statement is this. Moving to next question. Which drug is associated with cholestasis without portal inflammation? So that means the drug is mainly affecting the blockage. That means cholestasis, but do not affect the liver or portal system as such. So the answer to that is estrogen plus androgen. Estrogen androgens do not cause portal inflammation. They only cause cholestasis. Whereas acetaminophen, it causes acute liver failure. Obviously, portal inflammation will be there. It causes centrilobular hepatic necrosis. Centrilobular hepatic necrosis. That is caused by acetaminophen. Whereas other two drugs, amoxiclav and isoniazid, are also associated with hepatotoxicity. That means they can also cause portal inflammation. So the answer is estrogens. They do not cause postural inflammation, only cholestasis. Okay. Next question. Which drugs are used for clinical cure of malaria? We know clinical cure means that drug which kill the erythrocytic stage. So erythrocytic hydronticidal drugs, they are used for clinical cure. And remember, most of the drugs fall in this category. We have two type of drugs, fast acting and slow acting. Fast acting drugs we discussed several times earlier. They are remembered as machhar drugs. So machhar drugs. These include mefloquine, atovaquone, chloroquine group of drugs, chloroquine, amodiaquine, pipraquine, H for halofentrin and lumefantrine, A for artemisinin, so artesunate like drugs, and R for rescue. Rescue is the market name of quinine. These are fast acting. Then we have slow acting erythrocytic hydronticidal drugs like proguanil, which is metabolized to cycloguanil. Then we have sulfadoxine, pyrimethamine, which are always used in combination, sulfadoxine, pyrimethamine in combination. Then we have doxycycline. So these are the drugs which are slow acting, whereas these are fast acting, but all can be used for clinical cure. So for clinical cure, we can use artemether, sulfadoxine, pyrimethamine, chloroquine. But primaquine is the one which is used for radical cure. It kills hypnozoites, it do not kill erythrocytic stage, so it is used only for radical cure. So the answer to this is 1, 2 and 3. Okay, moving to next question. Erythropoietin is used for which anemia? We know erythropoietin is used when bone marrow is not producing enough RBCs, so it stimulates the bone marrow. So where it is used, mainly erythropoietin is used in two type of conditions. One, anemia due to chronic kidney disease, because chronic kidney disease, kidney produces erythropoietin. In kidney disease, erythropoietin will be lesser. Second, it is used mainly for anti-cancer drug induced anemia. Anti-cancer drug will suppress the bone marrow, erythropoietin will stimulate the bone marrow. And rarely, very less commonly, we can use for myelodysplastic stage related anemia. So although early stages or in very few cases it is effective, not in all. So these are the main indications of erythropoietin. It cannot be used for nutritional anemia. For that we will give iron. It cannot be used for aplastic anemia. So CKD and myelodysplastic, these we can use. So answer is 2 and 3. Okay. Next question. Which pharmacokinetic parameter is used for loading dose? So we all know the formula of loading dose. Loading dose is equal to volume of distribution multiplied by target plasma concentration. But this is the intravenous loading dose. And if we want to take into consideration the bioavailability, that means oral dose, then we will need to divide by fractional bioavailability. So it depends upon three factors: VD, concentration, and bioavailability. So VD, bioavailability, concentration, it do not depend upon half-life. So the answer will be 1, 3 and 4. So that is the answer. Okay. Next question. Which drug is not used for postpartum hemorrhage? So postpartum hemorrhage, we need to contract the uterus to stop the bleeding. So yes, we use oxytocin, which is a drug of choice. It is a strong uterotonic drug. Methyl ergometrin, again very commonly used. Then misoprostol is prostaglandin E1. It also contracts the uterus and used for PPH. Dinoproston is prostaglandin E2 and it is mainly used for cervical ripening. It is not used for PPH. It relaxes the cervix, so primarily used for cervical ripening. So the right answer is dinoproston. It is not used in PPH. Okay. Moving to next question. Which statement is true regarding pharmacological relationship between imipramine and diphenhydramine? First, we need to know what are these two drugs. What is imipramine? Yes, imipramine is a tricyclic antidepressant, whereas diphenhydramine is first generation antihistaminic. So what is common between the two? Tricyclic antidepressants, they mainly inhibit the reuptake of noradrenaline and serotonin, whereas H1 blockers are primarily antihistaminic drugs. But their other properties can match. So TCAs have very strong anticholinergic property. They have alpha blocking property. They have also antihistaminic property. They can cause seizures also. So four main extra properties of TCAs, whereas first generation antihistaminic which do not possess in second generation is they have very strong anticholinergic property and they can enter the brain. These are the two special properties of first generation drugs. So if we see what is common between them, both have anticholinergic property. That means both block muscarinic receptors. They can cause a dry mouth, blurred vision, tachycardia due to this property. So answer is both block muscarinic receptors. Okay, moving to next question. Which is most teratogenic and strongly associated with neural tube defects? So that's very clear. Answer is valproic acid. Valproic acid, V means very much teratogenic. So maximum teratogenic anti-epileptic drug is valproate, and we use folic acid to prevent this. The dose of folic acid is usually 4000 milligram. 4000 milligram to prevent the neural tube defects in pregnancy. So lamotrigine is least teratogenic, whereas valproic acid is most teratogenic. Okay, moving to next question. So this is a question in which there is normal ejection fraction, but there are symptoms of heart failure. So it is heart failure with preserved ejection fraction, and BNP level is elevated. So it is telling that there is volume overload also. Little bit volume overload may be there. So this person is on optimal doses of beta blocker and AC inhibitors. What is the next step? So if we see carefully, it is preserved ejection fraction. So digoxin, which is an inotropic drug, will have no role. That is used only for reduced ejection fraction. We want to increase contractility only when ejection fraction is less. Ivabradine is also indicated only in heart failure with reduced ejection fraction. And second thing, the person should have good heart rate, usually above 70 or more. Only then we use ivabradine. So here we will not use ivabradine. Then ranolazine is anti-anginal drug. It is not used for CHF at all. So it is out. So the answer is loop diuretic plus SGLT2 inhibitors. Now what is important is the main drug here is SGLT2 inhibitor. These are the drugs which can reduce the mortality in reduced fraction as well as preserved ejection fraction. The only drug which reduce mortality in patient with preserved ejection fraction. Second thing, loop diuretics may not be necessary always. Remember, the patient is euvolemic. If required, we can add loop diuretic, but they are not necessary in this person. But among the four options, the best answer will be loop diuretic plus SGLT2 inhibitor. Okay. Next question. So this is a female, 63-year-old female with UTI. So what UTI? So she is having flank pain. She is having hydronephrosis. So most likely obstructive. That means upper UTI. So it is upper UTI, pyelonephritis is there. So what is empirical treatment of complicated UTI? Complicated UTI. So answer will be meropenem. Meropenem. So remember, for the treatment of UTI, if it is uncomplicated, remember any UTI in male is complicated. But in female, if there is UTI, which is lower UTI, upper UTI in female is always considered complicated. If it is lower UTI, but there is no risk factors, like there is no diabetes, she is a diabetic female, so it becomes complicated. No diabetes, no other risk factor, then it is uncomplicated. So in uncomplicated UTI, the drug of choice is fosfomycin single dose, 3 gram dose, or we can also use nitrofurantoin. These are used for uncomplicated UTI, that means lower UTI in females without any risk factors. But if there is complicated UTI, that means any UTI in male, or upper UTI in female or female with risk factors. So complicated UTI, the first choice drug is usually ceftriaxone. But if there are risk factor involved like diabetes, etc., or upper UTI, particularly pyelonephritis, then we will not rely on ceftriaxone. We will give meropenem, which is effective against resistant organisms including ESBL. So meropenem will be the preferred drug, particularly in diabetic patients and for pyelonephritis, and both are present here. So the answer here will be meropenem. Okay, next question. So here the patient comes with septic shock and his febrile tachycardic, BP is low, hypotension, and despite adequate fluid resuscitation, and urine output is also low. So what is the next step? So remember, normally the drug of choice for septic shock is noradrenaline. But here noradrenaline will not be used because kidney is also affected. So we will use here dopamine. So dopamine is a drug of choice for shock with oligouria. Shock with oligouria. So remember, dopamine we will use at a dose of more than 10 microgram per kg body weight per minute. At this dose, it stimulates all the receptors. Remember, dopamine work on DBA, DABA, D1, B1, alpha 1. So by stimulating D1, it will increase the renal blood flow. Renal blood flow, it causes renal vasodilation, so urine output will improve. By stimulating beta 1, it can stimulate the heart, and the main action is by stimulating alpha 1, it causes vasoconstriction, which will increase the blood pressure. So the best drug here will be dopamine because of low urine output. Okay, next question, which is false regarding bempedoic acid. Bempedoic acid is cholesterol synthesis inhibitor. It acts upstream to the HMG-CoA reductase inhibitors. So what happens is acetyl coenzyme A, it is converted to HMG coenzyme A, which is converted to mevalonate, and that is converted to cholesterol. This is the normal formation of cholesterol. This enzyme is the rate limiting enzyme HMG-CoA reductase. Everyone knows. But from where this acetyl-CoA comes? This acetyl-CoA, it is produced from the TCA pathway, citric acid pathway, that is producing some compound which is converted to acetyl-CoA. What is that compound? It is citrate. So citrate is converted to acetyl coenzyme A by an enzyme known as ATP citrate lyase, ACL enzyme, ATP citrate lyase. This enzyme is first step in start of formation of cholesterol. So bempedoic acid inhibit this enzyme competitively. It competitively inhibit this enzyme. So citrate cannot be converted to acetyl coenzyme A. So cholesterol formation will stop. But what is special about this drug? Bempedoic acid is a pro-drug. It is a pro-drug. It need to be activated first, and it is activated only in liver. It do not become active in muscle. So it cannot stop this process in the muscle. So that means it will not cause myopathy. That was the main problem with statins. Statins cause myopathy. This do not cause myopathy. That is the major advantage. Now, second important thing to remember, where we will use this drug is used as an alternative to statins, those people who are developing myopathy due to statins, or it can also be added to statins. If statins is not producing adequate response, we can add bempedoic acid. Okay? So that is the important things you need to remember. Major side effect of bempedoic acid is hyperuricemia. It can result in gout, hyperuricemia, and sometime it can cause tendon rupture also. That is very rare. It do not cause myopathy, but rarely it can cause tendon rupture. Yeah? So that are the main points regarding bempedoic acid. Now coming to options, we need to tell false. Non-competitive inhibitor of ATP citrate lyase is wrong. It is a competitive inhibitor. It is dicarboxylic acid. Chemically, yes, it is a dicarboxylic acid. Inhibit de novo synthesis of cholesterol in hepatocyte. That's right. Inhibits synthesis of cholesterol by inhibiting this pathway. Used with statins. This is also right. So answer is it is not non-competitive. It is competitive inhibitor of ATP citrate lyase. Okay. Next question. Which drugs are used in acute mania? We know in acute mania, mostly we use lithium. Lithium with some sedative drugs. So sedative drugs, particularly the drugs which are used are antipsychotics. So we can use haloperidol, even valproate, they are used for mania, plus lithium is commonly used. Amitriptyline is a tricyclic antidepressant. It is used for depression, not for mania. It is used for depression, not for mania. So the answer is 1, 2, and 3. Is it clear? Moving to next question. So here a patient was taking carbamazepine and he was given erythromycin. 2 days later, the patient present with dizziness, diplopia, ataxia, confusion. So what is this? What is this? Why this happens? So simply remember, whenever there is ataxia, diplopia, that means cerebellar symptoms, they are overdose of anti-epileptic drug. Remember, all anti-epileptic drugs, they can cause cerebellar symptoms in overdose. So this is overdose of carbamazepine. The question is why overdose? Because erythromycin is a microsomal enzyme inhibitor. Remember we discussed vitamin K can cause enzyme inhibition. So E for erythromycin. So it inhibits the metabolism of carbamazepine. So carbamazepine cannot be broken, level increases and it start causing the cerebellar symptoms. So this is carbamazepine toxicity due to drug interaction. Okay. What is the role of phase 1? This is very easy question. We all know two type of metabolic reactions, phase 1 and phase 2. Phase 1 like oxidation reduction, phase 2 like conjugation reactions, glucuronidation like reactions. So phase 1, it will expose the functional group. So basically it make the drug sticky. When the drug becomes sticky, now we can attach phase 2. And when we attach phase 2, the drug become water soluble or polar. So the main function of phase 1 is to make the drug sticky. Sticky means expose the functional group. Whereas main function of phase 2 is to make it water soluble. And remember, after metabolism, every drug is water soluble. So the answer is, what is the main role of phase 1? It is to introduce or expose functional group for further metabolism. To make the compound more permeable is not wrong. It is wanting to make it less permeable. That means water soluble. Okay. So answer is C. Next question. This is direct question, which is used to reverse the muscle relaxation caused by weak chronia. We have two reversal agents. One is answer, which is neostigmine, and second is sugammadex. So neostigmine and sugammadex are reversal agents. So here is very simple question, neostigmine. Okay. Moving to the last question, which is correct about barbiturate and benzodiazepine. Both act on GABA chloride channel. That's correct. Absolutely correct. Both barbiturate, benzodiazepine act on this GABA chloride channels. They open the chloride channels that will depress the brain. Flumazenil is antagonist of barbiturate. Wrong. Flumazenil is antagonist of benzodiazepines. There is no antidote for barbiturate. Benzodiazepine increase the frequency. That is true, not duration. So benzodiazepine increase frequency. Barbiturate increase both duration and frequency. Barbiturate are used to treat acute anxiety. Wrong. For anxiety, we use benzodiazepines. Barbiturate are not used for anxiety. Benzodiazepines are used. So other three options are wrong. The right option is they work on GABA chloride channels. Okay. So these were the important questions that were asked in the INICET exam. Thank you very much.